Hand injuries seem so simple, but a lot of times it's not. It ends up becoming deformities, like kind of warping your hands, and they don't look normal or nice anymore. I'm going to share with you a story of a patient of mine. She's relatively young. She's got old lady hands right now. At least that's what she told me, because she injured her thumb and now her knuckle is giant. So let me share with you a story. I'm going to share with you what went wrong and what we're doing to fix it. So if this resonates with you, maybe you can have some hope, because one of her things was like she felt so hopeless with this injury. She's like, a year ago, this injury is a year ago. She injured it catching a football, playing out on the streets with her kids, catching a football, and caught it wrong, and it injured her thumb. So I always like to draw on myself, but this is your IP of your thumb. So your thumb is made up of 3 joints. We have a joint here, it's called your CMC, and then here, this is your MP. So I always say it's your big knuckle, your middle knuckle, and your little knuckle. For the fingers right here, but for your thumb, it actually sits right on top of your wrist. I'm going to share with you why that's important later. She injured her thumb right here, and what happened is, from that injury from a year ago, she now has a knuckle that will not straighten. It's like bent like this, and it's big. It's just like, it looks giant, it looks red compared to her other hands. So now what she has is, she told me, these are her words, not mine. She's like look at my hands. I have like old lady hands. Like I'm in my 30s and I look like I have 80-year-old hands, right? And so not only is she concerned with the appearance, but she just can't straighten it, and it bothers her. She can't bend it all the way down, and it doesn't hurt her that bad, but there's something about it that's really annoying. One is appearance, but 2, it's that nagging, like I still constantly feel it a year later. So I'm going to share with you what went wrong with her therapy, because I mean, it's not that it went wrong, it's just that it just didn't fix the problem, right? Like, the therapist that saw her did a lot of things right, but one of the things I always say as therapists is that we catch problems. My name is Huang. I'm an occupational therapist and certified hand therapist, and here at my clinic in Miami, Hands-On Therapy Services, we help people with a lot of different types of hand and arm injuries, and a lot of times it's like they've had it for years and they just don't know what to do with it. When she caught the ball, she dislocated the joint. So it just tore. So we have a ligament. So this is our bone. We have a bone here and then a bone here. And then on the sides of our knuckles, we have these ligaments. So when she caught the ball and it pulled and it hit her, it most likely tore that little ligament a little bit. I also think that she has a little bit of a fracture, because I reviewed her x-rays and I saw the befores, and I'm seeing what they look like now. She's being told that she has arthritis. Now, there's various types of arthritis. I don't want you to think that all types of arthritis is the same. She's developed what we call post-traumatic arthritis, not just like arthritis that comes with age and changes over time. Arthritis that comes with age and changes over time, called osteoarthritis, one of the most common types of arthritis. You'll see it in your knuckles, but you'll see it throughout both hands and in multiple different joints if you have it. Post-traumatic arthritis is, I got arthritis from an injury. Because of my injury, I'm not moving it like normal, and it's causing arthritis. So arthritis, very simple, is bone rubbing on bone, and it changes the shape, or what we call the congruency, how smooth that is. So if we have a shape here, let me see if I can draw. Like, we have a shape here that's like a ball, and then we have a shape like this. So together it sits, let me see if you can see that. Together it sits in a particular way, and then we have ligaments on the side that kind of holds it together. And then we have muscles and tendons that attach and pull. So we have a really long muscle. It ends here, but it actually starts in your forearm. So I often talk about, this is your thumb, this is your little knuckle, your middle knuckle, and your CMC. So this thumb sits on top of your wrist, and the reason why your wrist is really important is because that tendon passes through your wrist. How you are positioned makes a big difference when you're working on your thumb. So because she has this deformity here, it is what we call as therapists, we call it a contracture. So her doctor says that she has developed this contracture, and now she has post-traumatic arthritis. And all that means is because you're not moving it really well, everything is so tight that is pulling and pulling and pulling the joints together, and now it's just rubbing. One of the things that I told her was like, well, you're gonna develop that, or it looks like that. It looks so big and like this huge giant bump on there, is because your bones are not sitting in alignment like it's supposed to be. So if you imagine two bones are supposed to be stacked like this, one is sitting more like this. Sometimes if we look at it from the side, sometimes it's just sitting like this. Now it's very, very small, so you can't always see that on x-ray, but she was really skeptical about coming to therapy because she didn't know if it was going to work. She told me, I've tried therapy, I've been doing it for like a year. Technically speaking, she did her therapy in the first 4 months after the injury. And then now it's been a year, but she still can't fix it. So she was telling me one of the things that she was doing was she was doing all the exercises that the therapist had given her prior. There is absolutely nothing wrong with the exercises that were given to her. They were all strengthening exercises, which I told her were great. But whatever you use to fix that first problem, you can't use to fix the second problem. They're not the same problem. So if you're not fixing the right problem, if you're doing things but you're not doing the right thing to fix a problem, you can't fix it, right? So she has what we call joint contracture, meaning it's really stuck right here. And the most important thing that we could do as therapists is to help you diagnose what the actual problem is. It's not a strength problem. So doing all the gripping stuff, doing all the twisting stuff, that's not going to help, because we don't have a problem bending it. We have a problem straightening it. And if you get more straight, we can straighten it even more, then the bending actually will become easier. And that like blew her mind, because she was just like, what do you mean? Because if we straighten it and we get the joint in better alignment and we pull it, this muscle that pulls you down, it's going to have a chance to get longer. So when it has a chance to get longer, then it has a chance to bend all the way down, right? Does that make sense? Let me know if that makes sense. Finding the real problem is that's the first step. Like if you're fixing the wrong problem, you're not going to fix it. If my car is broken and I just go and I get it detailed and I wash it and I vacuum it, I've fixed the wrong problem, right? It's not going to run. So she has a joint contracture, so strengthening is not going to work. Second question, Huang, how do I know therapy is going to work, right? I don't know until I see it. A lot of people send me requests and questions. It's not responsible to do a quick do this, right? Because I don't know the problem. You have to find out what the real problem is before you can actually fix it. So I don't give out personalized medical advice. So one of the things that we did was, this is really hard to do on your own. I always say when you have a knee injury, you have two hands and you can massage your knee and you can stretch your knee. When you have a hand injury, you have to use one hand to figure out what's going on here. So one of the things I did was I held this bone and then I held this bone and I took it and I pulled it apart. Once I pulled it apart, I started to move it around a little bit. I started to shift it around and I was able to show her so let me see if I can show you. If I pull from here, right? You can't really see it here, but you might be able to see it here. You see how my joint kind of like dimples right here? Or you can kind of see it more when I do it here. You see how if I pull from the tip, it pulls from here? So one of the things I did was I held here, pulled it apart, and I was able to shift that joint around. To me, that felt like, oh, we have a chance. So if you're watching this video for just some hope of what could you actually do, take this as an opportunity. You can share this with your therapist. You can talk to your therapist about it. Go to a certified hand therapist. Go to a hand therapist who specializes in this type of problem. So we're able to showcase hey, your joint actually has some movement. If it didn't have any movement, it would already have been kind of fused, and then therapy can't do anything about it, right? You want to fix that appearance thing, you're going to have to go to surgery. So that's one of the things that I do with my patients. I'm like, we have to try out methodologies, we have to try out some treatments, and then from there we can say, is therapy going to help or do you need to have surgery? So that's what we did. We did some what we call joint mobilizations. We moved it around, we stretched it, And then I made my recommendations. I recommended that she do what we call plaster casting. Now, I know a lot of people watching YouTube videos are trying to like do stuff on your own. Can't really do plaster casting on your own. I don't care if you know how to do it. You have to do it with someone else because they have to actually mobilize your joint, move it, and then they have to cast it while doing it so that you can get it as straight as possible. It's a very particular type of protocol to help contracted joints move better because it's a low and slow, prolonged process. But we were able to make significant gains from that one session. This is not all we did, but this is what part of what we did. So when you go to stretch this joint, right? I'm going to show you the stretch we did. Because of how the thumb sits on top of the wrist, you have to pay attention to not putting pressure here because you're going to fix something and cause another problem, which is what she was doing. So then her thumb started to hurt. So when you go and you grab your thumb, you want to be mindful of how you're holding this one and this one so that you can put only pressure here, right? This is also helpful. You know how your swelling goes up and down? So people leave me comments all the time like, oh, it's been like a year, it's been 2 years, but my swelling gets big and it goes down, it goes up, it goes down, it's still red, it's still swollen. Every single time you have something like that, but your joint is also stuck, that means usually that your joint, that joint has the capacity for more. It has the capacity for more. So because it can get more, it keeps getting irritated. It's like chafing, right? And you know you're chafing, but you can't stop it. You're gonna keep irritating it, right? So that's what's happening here in this joint. It gets irritated and gets better, gets irritated, gets better based on what you're doing, how you're moving it, how aggressive you're stretching it, because that's when she would feel it the most. She was like, I would feel it so hard, so much more when I was when I was really aggressive to it. Again, when it's contracted like this, you need a low, slow, prolonged approach. So one of the things we did was we held here. And so what you want to do is you want to use your other hand to cup this, and then sit your thumb on your index finger. Don't squeeze it. Sit it on the index finger. So what you're going to do is you're going to push up with your index finger, the side of your index finger, and then you're going to push down with your thumb onto that joint. That's it. I'm making it look easy because I don't have a problem, right? But when you are working on yourself, it's hard. It's hard because you have to apply the pressure in a very specific way, then feel a little bit of that stretch without it being painful. When you're stretching and it's painful, you are causing more of that chafing. You're causing more of that irritation. So then what happens is it gets irritated, it gets inflamed, and then you go into the cycle of going up and down. Just like lay off, right? Move your thumb a little bit. So when she was pressing on this side, it was hurting. So I said, just move your thumb a smidge and press right into the center, and then it won't hurt anymore. So yeah, she's like, yeah, it didn't hurt. So then do that, right? It is not a no pain, no gain scenario. You have to kind of figure it out, which is why it's important to, if you have the capacity to go and get some help. I know some people have been reaching out and they're like, where I live, I don't know anyone, or you just gotta look around and find, right? But here, this is one of the things that I taught her to stretch, and the key component here is a low, prolonged stretch. So it's not like just 10 seconds. You're just hanging out there and holding it for as long as this thumb can tolerate, right? That's one of the biggest things. You don't want to stretch it where you're putting your hand down. Let me see if I can show you. You don't want to stretch it where you're putting your hand down and pulling or going like this, because then when you do this, you're putting pressure on this joint and this joint, and you can cause yourself other problems, right? You can stretch it yourself, but honestly, one of the things that has worked the best in my experience, having done this for over 25 years and working with a lot of stiff joints, is plaster casting. Ask your therapist about it, see what you can do. For the thumb, they're making something like pull is really, really hard because you have to control different joints, and then you have to control the wrist as well because of how the thumb sits on top of the wrist. You want to get rid of old lady looking hands. You have to move your joint to its maximal capacity. If its maximal capacity is to get more motion, then you have to do the due diligence to get more motion for that joint so it can stop getting swollen, so it can stop hurting, and so you can have more motion and not have these deformities that make your hands look like you got old lady hands. Let me know if this helps you, and if you need my help, my link is below. Again, my name is Huang. My therapy clinic is located in Miami, Florida, and you can reach out to my team and see how we can help you. All right, thank you.